Good afternoon. My name is Angela Ortiz, and I come before you today to testify in favor of House Bill 4112 and House Bill 4113. I am the mother of a 5-year-old with complex medical needs, and I have seen firsthand why patients like my daughter, Ayla, deserve the improved patient care these bills would provide. Ayla has been hospitalized over 15 times since birth, and she will face many more hospitalizations in her lifetime. I am her mother, I am her voice, I am her advocate. It is my duty and responsibility to keep her safe in every environment, and in this case, the hospital, the place I am sending my daughter when she is at her sickest. Over the last 5 years, through our own lived experience, my husband and I have come to realize that nurses are spread too thin with too many patients, and it directly affects the care that Ayla and other patients receive. One of us must always stay at the hospital with her, day and night. We will be asked to provide medical care for Ayla to help manage their workload. Even with our vigilance, there will be many medical errors. During a recent hospitalization, Ayla fell asleep, and I decided to grab a quick cup of coffee. Upon my return, her nurse mentioned to me in the hallway that she heard Ayla crying and sent a nursing student in to console her. When I entered the room, I noticed there was a light pink stain around the right side of her face where she was laying. I knew right then and there Ayla had thrown up one of her medications that she'd been struggling to hold down for a couple of days. Keep in mind, Ayla's inability to tolerate her feeds and medications was the reason for this admission. The immediate thoughts that came to my mind were, I never should have left her. I know better than that. Why was she given medication and then left alone, knowing her risk of vomiting within 5 minutes of a med being administered? Why didn't anyone sit her up immediately? She could have aspirated. She could have choked. And although this is a minor incident compared to what we've experienced in the past, it still adds to that unquestionable fear I have for her safety, in an environment I always believed she would be safe. If Ayla were in a daycare, there is a law in Massachusetts that sets a safe maximum limit on the number of children that a child care provider can care for at one time. But once she enters the hospital, she loses that protection. Once a child, any child, gets to the hospital, there is no law and no limit on how many other sick children his or her nurse will be responsible for at one time. When these children are at their most vulnerable, they lose that basic protection. It doesn't make sense. As a mother of twin girls, as a daughter of aging parents, as a wife of a leukemia survivor, and as a potential patient, I support these bills, this ballot initiative, because I know that they will ensure all patients in all hospitals will receive the care they need when they need it most. Thank you.
Thank you, Angela.